All right, so this is our week 2 live lecture. So we're going to talk about ASRT ethics. Hold on. No, that's what we're going to talk about. We're going to talk about safety. So patient care pharmacology, we're going to start off talking about safety. So it's very important to keep our environment safe, not only for us, but for our patients as well. So in the radiology department, there are several things that we need to be aware of. So some common safety concerns that you may be aware of in your facility is number one, fire. The second one is falls. Third one is chemical. And then the fourth one is eye splashes. So does anybody know what the acronym RACE stands for? If you do, type it in the chat. Okay, anybody know what RACE, RACE, what that acronym stands for?
Rescue, alarm, contain, and extinguish.
Yes, ma'am. Okay, I need more answers. I have 35 people logged in. I only got 9 answers. Well, 10, counting the one we just got verbally. Okay, so who was that said it out loud?
Me, Tiffany Diaz.
Okay, thank you, Tiffany. Now sometimes you will these words can be interchangeable. So R, remove and alert, A, alert and activate, C, contain and close, and E, extinguish. So there are some variations in there in the words, but basically what it's telling you to do is if we in the event of a fire in our facility, how we should handle that. The next one that's dealing with fire safety is PASS. This acronym basically is an acronym to show us or tell us how to work the fire extinguisher. So P is pull the lock pin, A, aim the nozzle at the base of the fire, S, squeeze the handles together, S, sweep from side to side. So those are 2 acronyms you need to be familiar with when it in regards to fire safety. So the next one is falls. So we deal with a variation or a variety of patients. We deal with infant patients. We deal with older patients, and a lot of times our older patients, they have a tendency to fall. They may have issues with their balance. So reducing the risk of falls and collisions is a major safety concern in hospitals. So what can contribute to falls could be the patient may be experiencing a loss of sense of balance and a lack of depth perception. So when you're dealing with patients who are fall risk, you want to make sure you give clear instructions and you never want to leave the patient unattended. And also you want to assist them as much as you can. You kind of want to do assessment of the patient to see how much they can and cannot do. And then once you assist the patient, if you need to get help, to move the patient, if the patient can't move by themselves, or you feel like the patient is too unsteady, then you can call for help so somebody can help you. The next one is chemicals. So what does MSDS stand for? Is it A, Medical Society of Diagnostic Sonography, B, Material Safety Data Sheet, C, Medical Safety Direction Society, or D, Medical Services for Diagnostic Safety? So B is correct answer, Material Safety Data Sheet. So this is important to be aware of because this is basically an area where they kind of put together the different materials that we have in our department. So they list out cleaning agents, as simple as household cleaning agents, or as complex as radioactive testing materials. So each hazardous material should be on file and easily accessible. And the MSDS for any chemical will indicate the required equipment and procedure for safe handling in the event of a spill. So it's important to know where your MSDS is, or your material safety data sheet is. They used to, a long time ago, they used to keep it like in this yellow binder. But now I think a lot of facilities have gone to keeping it on the computer, kind of in a shared drive that everybody can access. So you need to be familiar with where that is, just in case you need to access it. Or if you ever have somebody coming in the facility doing a survey, they may ask you, do you know where the MSDS is? So you need to know where it's located. So next, eye splashes. We work with different bodily fluids. We work with contrast. We work with all different types of things. And we can experience something getting in our eyes. So if that happens, there should be designated emergency eye wash stations in your facility. This is basically a first aid station for chemical eye splashes that provides a spray of water to the eye from a convenient height. Prompt treatment is essential for chemical splashes in the eyes. And the eye wash station, if the eye wash station is not available, you can always use running water. Um, if you don't have one of these in your facility, it is fine to use running water if you have any type of chemical or bodily fluid spill that gets in your eyes, splashing your eyes. One thing I will just kind of warn or caution you is that if you go use a sink with running water, make sure you don't turn on the hot water. Make sure it's cold water, because you don't want that having hot water flowing in your eyes. But if you are aware of where this is, it should be somewhere that's out, everybody can have access to. It is checked, should be checked regularly to make sure the temperature of the water is okay and that it actually works. So it should be somebody that's checking and keeping a log of what's happening in that with that eye wash station. So next we're gonna talk about some hospital acquired infections. So which of these, or which of the following, are considered hospital associated infections? So is it A, MRSA, hepatitis B and C diff, B, MRSA, HIV and tuberculosis, C, MRSA, VRE and C diff, or D, tuberculosis, HIV and hepatitis B and C? Okay. So correct answer is going to be C, MRSA, VRE, and C. diff. Those are all considered hospital-acquired infections. Fun fact, the most common hospital-acquired infections are going to be bloodstream infections, pneumonia, and then urinary tract infections. So those are three of the most common. So hospital-associated infections, or they're also called nosocomial infections. Like we said, MRSA, VRE, C. diff. What that means is that when you came to the hospital, you were fine. You did not have this type of infection. But during your hospital stay, somehow you contracted this type of infection. So basically what it means is you came in, you were fine, or you had none of these infections, and then while you're in the hospital during your hospital stay, you acquired one of these infections. The thing is with this hospital associated infections, it can affect reimbursement, because when we care for our patients, it's expected that we clean, and we make sure we don't pass different things or different infections and diseases from patient to patient. So a lot of times if a patient acquires MRSA, VRE, or C. diff for some of these other infections while they're in the hospital, reimbursement can be cut. So they'll say, well, we'll pay up until this point, but we're not paying for any treatment of the MRSA because the patient didn't have it when they came in the hospital. So it can affect reimbursement. Next, bloodborne pathogens are going to be HIV and hepatitis B and C, and then your infectious diseases is going to be tuberculosis. All right. So cycle of infection. We're gonna watch a video about cycle of infection, but this diagram and these points basically tell us the story of how someone gets infected and how it goes from person to person. So we're gonna watch this video about the cycle of infection.
Is there audio to the video? Because I'm not able to hear it in my end.
An infectious agent is an organism having the ability to cause disease. To break this link, seek prompt treatment if you are ill and use the right cleaning solution to disinfect the pathogens you have identified.
Hold on. Okay, let me start it a little bit, go back a little bit.
But the chain is easy to break. Each link can be broken, which prevents disease and keeps patients safe. Let's go through each link. An infectious agent is an organism having the ability to cause disease. To break this link, seek prompt treatment if you are ill and use the right cleaning solution to disinfect the pathogens you have identified. The second link is a reservoir. A reservoir is where pathogens can thrive and reproduce, like tabletops and doorknobs and people. Break this link by washing your hands, keeping a clean environment, and disinfecting surfaces. Next in the chain is the portal of exit, which is how the pathogen leaves the reservoir, such as sneezes or coughs. Break this link by wearing personal protective equipment, washing your hands, properly disposing of trash, and covering your cough or sneeze. The fourth link is the mode of transmission. This is how pathogens are carried from one place to another, even on the hands of a healthcare worker. To break this link, wash your hands, control airflow in negative pressure rooms, disinfect surfaces, handle food properly, and observe isolation precautions. Next, the chain includes the portal of entry. It's the way pathogens enter the host, like breaks in the skin. Healthcare workers break this link by practicing aseptic technique during procedures, taking proper care of wounds, washing their hands, and properly caring for catheters. The last link in the chain of infection is the susceptible host. The host is a person who cannot defend against pathogens, such as the elderly or burn patients. Healthcare workers break this link by treating the primary disease and identifying those at higher risk for infection. As a healthcare environmental services technician, you can see how your daily duties give you many chances to break the chain and keep everyone safe from illness.
Okay. So just to kind of recap those, the different chains. So your infectious organism or your infectious agent is a disease-causing pathogen like a virus, bacteria, fungi, or parasite. Then your reservoir or source is the environment or habitat where the pathogen can live or multiply. Then we have the portal of exit. This is how the pathogen leaves the reservoir, such as through the mouth, cuts in the skin, or during diapering or toileting. The mode of transmission is how the mode of transmission or susceptible host is basically how the pathogen spreads, such as through contact, droplet, or other potentially infectious material. Then you have portal of entry. This is how the pathogen enters another person, such as through the mouth, cuts in the skin, or the eyes. And then you have transmission of disease. So this is the person who is vulnerable to the infection, such as the baby, children, elderly patient, people with weakened immune systems. What do you guys think is one of the biggest sources or reservoirs of how we kind of pass these type of pathogens on? I read about this earlier in the week, and it really surprised me. It's something that we use all the time, quite frequently, and you would never think that it's contributing to this, or it can, cause spread of infection.
I have a question. Do you mean as in the radiology department or overall as like
Just
person to
something
person?
something that you use in everyday life.
Oh, a phone?
I'm gonna let everybody answer, and then that is a good guess. So it is a cell phone. So just be mindful of that, because if you think about it, we have the cell phones in our hands all the time. We put it on different surfaces, we pick it up. You know, it's good to kind of take some alcohol wipes and make sure you wipe off your cell phone, the screen and the back part just to kind of keep it clean. But that kind of surprised me that that's one of the biggest ways that we can spread infection and pathogen is just basically from using and holding a cell phone. All right. Transmissions-based precautions. So there are times when we have patients who have different conditions, and it's important that we follow these different precautions so we don't spread germs. So the first precaution is airborne precaution. This is used to prevent diseases such as tuberculosis and measles. Then we have droplet precaution. This is used to prevent the transmission of diseases such as diphtheria, pneumonia, and influenza. Then we have contact precautions. This is used to prevent transmission of diseases such as multi-drug resistant wound infections caused by MRSA, VRE, and strands of E. coli, C. diff, and various other skin infections such as infantile. So these are just kind of a few of those measures that we take in addition to our standard precaution like making sure we use gloves and washing our hands. Though these are some other precautions that we can take to aid in the spread of not spreading infection. So the best way that we're going to fight spreading infection is going to be hand hygiene. So hand hygiene can be washing of the hands, or it could be the alcohol-based rubs. So for washing hands, you should wash the hands between 30 and 60 seconds with soap and water, or like I said, you can use the alcohol-based rubs. Sometimes those alcohol-based rubs can dry your hands out if you use them a lot. I know me personally, I don't feel like my hands are clean unless I wash them. So I may do the alcohol-based rubs a couple times, but then at some point, maybe after the third or fourth time I've used it, then I go wash my hands. So using either one of these methods is going to help fight, the spread of infection. But if you have visibly soiled hands, so if you have something on your hands like blood or any other type of material, best way to clean your hands is going to be to wash your hands. Okay. So some cleaning techniques that we need to be mindful of, because we have patients, they come lay on our tables because we have to, do their x-rays. We have door handles that we touch to go in and out of the rooms that we use. We have portable machines that you kind of touch, and everybody, uses the portable to go do a portable. We have consoles that people have to touch and, to select protocols and techniques. So it's important that we make sure we maintain cleanliness of those surfaces. So cleaning reduces the incidence of airborne infections and the transfer of pathogens by fomites. You always want to clean from the least contaminated area toward the most contaminated area and from top to bottom. Usually, if you work in a facility and they have patients who have their own contact precautions, they come to your room and you have to do an exam on them, we'll get housekeeping to come do a terminal clean. So that's what housekeeping follows, or our environmental services staff, when they come clean our rooms, they follow the cleaning from top to bottom, least contaminated to more contaminated areas. Avoid raising dust. Don't contaminate yourself or clean areas. And then after each use, clean our equipment that comes in contact with our patients. So we know we have all types of wipes these days, or all types of different tools we use, or agents we use to clean. Some people use hydrogen peroxide wipes. Some places have different like wipes, purple top wipes, orange top wipes, gray top wipes. But at the end of the day, you need to be using one of those to clean your equipment. You also is recommended to know the wet time. So how long does that disinfectant or that cleaning agent need to stay wet on that table to effectively get rid of whatever could be there. But making sure you wipe down your tables after every patient, that's gonna help not spread the germs around in radiology, because our equipment is used very often. If you are cleaning like a console or some type of equipment, the best thing to do is make sure you use or go by the manufacturer guidelines for cleaning. A lot of the manufacturers will have information on what to use to clean the equipment and what not to use. So you always want to make sure you know manufacturer recommendations for cleaning your equipment. Okay, so next topic we're going to talk about is ergonomics. Why is ergonomics important to us as technologists? Because we do a lot of repetitive motion work. We do a lot of standing, bending, lifting. We move patients, we push portables, we push wheelchairs, we push stretchers. So we do a lot of things that other people that sit behind a desk don't do. So when you do a lot of those motions, we do a lot of walking, there is a chance you can injure yourself. So ergonomics is the study of the human body in relation to the working environment. Ergonomic awareness and education in the workplace have reduced job injuries in recent years, and the principle of proper body alignment, movement, and balance are basically the foundation of ergonomics. So rules of body mechanics. So if we have to lift something or move something, how do we properly do that? You want to provide a broad base of support, work from a comfortable height. When you're lifting, you want to bend at your knees and keep your back straight. You want to keep your load well balanced and close to your body. You want to try to roll or push a heavy object instead of pulling or lifting. Now, one thing we're fortunate, and some people may not be as fortunate, but when we work in teams or we have people in our department to help us, then that kind of, takes some of all the burden on one person to do all the moving and lifting. So anytime you have a patient that needs assistance and you don't think you're going to be able to help, I suggest that you ask for help, because you don't want to injure yourself. I know a lot of times with our ultrasound techs, they do a lot of repetitive motion, so they tend to have issues with their wrist carpal tunnel. But I've known technologists to hurt their back doing certain things, moving patients, patients not being able to stand up by themselves and them falling, and the tech goes to try to catch the patient, or the patient falls on the tech, and both of them end up on the floor. So that's one thing, that probably a lot of people don't talk about our profession. It can be a bit physical depending on what environment that you work in. So following the ergonomics, making sure, you're using the correct body mechanics. A lot of your facilities will do ergonomic evaluations for you. If you sit at a desk or a common area, they will do ergonomic evaluations to kind of help you, help make sure your desk is at the right height, or you have the correct kind of keyboard, or you have the correct kind of chair with back support. So facilities will do that to help you out. And then lastly, patient transfer. Like I said, a lot of times we're moving patients. We have patients. A lot of times you work in outpatient. Your patients, we call them walkie-talkie or ambulatory. They're not going to need as much help. But then you may get in a situation where you work in a facility, in a hospital, or a setting where patients are on stretchers, or they're in wheelchairs, or they're in the units and they really can't move too well. So you want to make sure you follow patient transfer rules. So so your patient, or the person that's going to be helping you don't get hurt. So if you're gonna transfer a patient, number one, if they're inpatient in the hospital, you want to check with the nurse. You want to check with the nurse to make sure to see how the patient is. How much can they help? Are they awake, alert, oriented? Also, if you're in a hospital and you are going to get a patient and to bring to the x-ray department, say you working in the ER and you need to transfer a patient from a wheelchair to a stretcher, or from stretcher to another stretcher because something's wrong with the stretcher they're on. You always want to check with the nurse to make sure that it's a good time to do your exam. Then you want to check your patient identification, of course, make sure you have the right patient. Use your 2 patient identifiers to identify your patient. You want to plan what you're going to do and prepare your area. Then you get your equipment and check it for safety and function. You want to enlist the patient's help and cooperation. So like I said, you want to see how much the patient can help you. You want them to do as much work as they can, so it takes the burden off of you of trying to do it. And like I said, you never want to try to do this yourself if you feel like, the patient may be too big for you to move, or the patient has too many limitations for you to move by yourself. You want to make sure you ask for help. Now, we do have aids that can help us. We have patient transfer boards that we can use. I know in my facility, we have a big roll of plastic. And they're just they look like plastic wrap, but it's just a bigger roll. And we can tear a sheet of plastic off and we can put it on the table, and it kind of helps us transfer patients from stretcher to the CT table. Then also we have this spray that we can spray on our CT table that makes it a little bit slick. I think you can spray it on the x-ray table too. It makes it just a little slick to kind of help move back and forth. So you need to, enlist, if you have help, it's good to have 2 people, but also if you have some type of transfer aid, they also have lifts you can use, portable lifts. Sometimes they have them in the ceiling, sometimes they have the portable ones you can kind of bring to the patient and pick them up and move them. But if you have that equipment, even if you're working with somebody, it's good to use that equipment. And then next, communicate with the patient what you're doing, obtain additional help if necessary, and then make sure we've communicated the role of everybody in assistance in the transfer plan. So make sure we got somebody kind of directing the show, counting it off when we're going to move the patient to the table and when we're going to move them back. So those are the big things with patient transfer. All right. So here is the week 2 study guide questions. One thing I did want to kind of tell you guys, number one, I was going through your discussion this week. A couple things that I saw, some of you are not using or integrating a quote from your weekly reading. So if you go look at your discussion guidelines, it states that part of the assignment is to integrate a quote from your weekly reading. It's okay to use a additional source, but you have to meet that assignment guideline first before you use your additional source. Now, also with APA, there's 2 parts to it. So there's an in-text citation that gives credit to the author's words, and then you have a reference that gives credit to basically the body of work that those words came from. So there are 2 parts. And then I had a couple students to not even attempt the in-text citation and or the reference. So make sure you guys are following directions and that you're at least attempting to do it. For those who did it and it wasn't correct, if you look at my grading comments, I basically showed you how it should be. So you guys have that example going forward, you know what it should be. So those are some things that I saw from discussion. The second thing is that when I provide you guys with a study guide, but your tests are pulled from the test banks of the chapters that we cover every week. So that means that your tests are computer generated. That means that everybody may not have the same questions on the test. I try when I give you guys a study guide, I try to give you as many of the topics that I can think of that could possibly be on the test, but there's no way for me to tell you everything that may be on the test, because if it's pulled from a test bank and it's each chapter has 100 questions from the test bank, that means that's a total of 200 questions that can be pulled for you to be tested on. So, it's hard for me to kind of give you an overall study guide that's going to cover 200 questions, because that's a lot. So I try to go through your quizzes and find common questions that tend to come up on different occasions, or questions that, in the past that students may not have, you kind of did good on. So I try to include those in your study guide. But I just kind of want to kind of give you guys an idea of that your tests are pulled from the test banks of the chapters that we study every week, or chapters that we review every week. So I try to give you the best study guide I can. But just know there may be times that what's on the study guide may not be on your test. That's why it's important that you read your book and that you go through, the PowerPoints that we have and all the learning activities that we provide for you guys to make sure, you'll be ready for your test. So are there any questions about anything we went over? Anything for last week?
I have a question regarding to last week assignments. So
Yes, ma'am.
I do live in Houston, Texas. So we didn't have hurricane, and I didn't have power for the whole week. And I see that one of the feedback comments late submissions. So I just want to get a confirmation that I was told by TCP that we had extensions for certain, no, not for certain things, for assignments, because people didn't have power. Because
Yeah,
I know in my
and
classes.
that's correct. And so if you emailed me and told me about the situation, then more than likely I didn't put those comments there. But if you didn't email me and kind of tell me, that what was going on, I don't know that. So if you turned something in late and it was due to that, I didn't count off. I don't think I did. But if I counted off something that was late and that was your issue, send me an email, because like I said, I had a couple students reach out and say, hey, I'm things are gonna be late. I didn't have power for a week or whatever. And with those students, I was like, okay, cool, extension. But if you didn't reach out to me and let me know, then, and I counted off, just send me an email and I'll update your grade. Cause
Well, that's fine. Just because, like I don't have internet either. Like I don't, like in my end, like there's no way I can send an email because I was looking up that my employer was able to give me at some time. So I didn't give an email for that reason because I didn't have Wi-Fi. Like maybe I didn't have even service either. But I
that's
did let
fine.
you comment
Just
back. Uh-huh.
Yeah, that's fine. But just send me an email and let me know the circumstance, and then I'll update your grade. Because like I said, I had no way of knowing which students were affected and which students were not affected. So just send me an email, let me know, you had to turn your work in late because of the situation with the hurricane, and I'll update your grade.
Okay, that's fine.
Do we have any other questions?
I have a question about the Rad Tech Bootcamp.
Yes, ma'am.
Is there a certain way that you want us to submit that information?
What do you mean?
Because like I finished all of my assignments on Rad Tech Bootcamp, but I think I made like a 50 on it. But I don't know if it was because maybe I submitted the assignment wrong or there were no comments on it. Because it
What
said to take a screenshot, so I took a screenshot of it.
Yeah, and that's what I want you to do. So with Rad Tech Bootcamp, you have a series of of videos to watch, and then you have like an overall quiz, or you have a series of little quizzes, and then you have one quiz at the end. So
Yes.
I specify which one that I want you guys to send a screenshot of, so I can give you, because I have to manually grade that assignment. It doesn't transfer over to Canvas. So that's why I'm asking you to do a screenshot. So if the if it was 80, if it was 80 points, you made 80 out of 80, that means you got full points for the assignment. But that's the reason why I asked you guys to do a screenshot, because I have to manually grade the Rad Tech Bootcamp assignments. Does that answer your question?
Kind of, because I just did every single assignment that was related to that topic. I did every
And you,
single assignment and took the assessment.
yeah, and you should. So there should be a group of assignments, and then the final assessment or final quiz is what I need to see the grade on. But you should be doing watching all the videos or doing the smaller quizzes, because it's gonna help you with that final quiz at the end.
Okay. Can we resubmit it? Because I don't know if maybe I submitted it wrong, because I made like an 86 on my assignment, but for the grade that you gave me, I got a 60.
If it's something that's already been graded, no, you can't resubmit it.
Okay. So our
Um,
final our quiz grade should have been what we made on the Rad Tech Bootcamp quiz, right?
yeah. So if you go into the instructions, hold on. Okay, so this was the one from last week. So it says, go to the learn icon, find the module, patient care, the legal and ethical issues. Complete all 8 lessons, and then complete the guideline assessment regulation lesson, which should be the last lesson. And so that's what you're getting graded on, that last lesson. That's what your grade is coming from. And if it lets you take it multiple times, I don't have a problem with you guys taking it multiple times. I don't know if it's going to record your highest attempt or it just records your last attempt. But if it allows you to take it multiple times during the week or multiple times when you're sitting down taking it, I'm fine with that. And then you can screenshot me your grade after you've taken it however many times you want to take it.
Okay, I was just wondering because I made a 68 on mine, but that's not the grade that I got on my final grade.
Which one are you talking? Are you talking about the one from last week?
Yes.
Okay, I'll take a look at it. What, I don't know who's speaking. What's your
Well,
name?
I also have I'm sorry to interrupt. I also have the same thing as her. Like my grade looks different on the Rad Tech book, and then when I take a look at it, doesn't show feedback. Why are you deducting? What's the reason why you're deducting the points?
So last week's Red Tech Bootcamp was worth 80 points.
Exactly,
So
and I got a
it,
90 on my thing, and I got a 73 out of 80, and doesn't show a
but
feedback. What's the
so
reason?
so if you take 73 and divide it by 80, that's your grade. So you say it's worth 80 points. So if you say I made a 73 and you divide that by 80, that's a 91. So I actually gave you guys an extra point. So if you made a 90, I gave you 91. So that's why you have a 73 out of 80. It's not an assignment that's out of 100 points. So you have to take the number that you got correct and divide it by the total number of questions that was on the test, and that gives you your grade.
Oh, okay. Now I understand, because usually because I guess because every professor is different, because they usually put 100 out of, whatever, to make it easier for us. But I get it now. Understand.
Yeah. So the Rad Tech boot camps, they're not gonna be worth 100 points, because they're each assignment tells you how many questions it is. So if the assignment has 30 questions, it's gonna be 30 out of 30. That one had 80 questions, so it's gonna be 80. The highest you can get is 80.
No, I know, I understand that. I'm just saying as other teachers, those who use a rat tape bootcamp for like digital control, they just for them to make it their life easier, they just put 100 for us.
Oh,
You know, they just simplify it for us. No, that's fine. I understand.
okay. So somebody said it records the highest. So like I said, if you guys want to go back and do it during the week before before it's graded, that's fine. Are we able to go if we don't have any questions? Yes, Thomas, you can. Can you show us an example of how you want APA citation? Yes. So this is the website that is referenced in the course for APA. So when I did the last syllabus review, I told you guys I tend to like this website because to me it explains it a little bit better. So if you go here, it lists out in-text citations and how to reference. So it gives you instructions on it. So for your in-text citation, you should have both authors' last names. It should have the publication year of the textbook, and it should have the page number where you found the quote. So that's basically the formula for your in-text citation. The textbook that we use, it has 2 authors, so you should have 2 last names. You should have the publication year of the textbook, and then you also should have the page number where you found the quote. So that's the format for for the in-text citation for APA. Does that make sense, Victor? And it kind of shows you, this is one of the examples that it has right here. It shows the quote, then it has the author's last name, the publication year, and the page number. But since the textbook has 2 authors, you'll have 2 last names there. Okay. Any other questions before we close? All right. If not, then okay, that's what I meant. I couldn't picture. Okay. You're welcome. Any other questions before we part? All right. If y'all don't have any other questions, then you can type your name in the chat box. And y'all have a good rest of your night. Thanks, guys.